Once again, let me take this opportunity to welcome our new governor, Chief Rochas Okorocha. I'm sincerely aware of the huge problems he has inherited from his predecessor and urge the people of Imo State to exercise great patience as he wrestles with these problems and tries to find lasting solutions. I hope he is a great listener and a keen observer, because it will take more than a few heads and a few eyes to realize the true state of affairs in Imo State. I also hope he is surrounded by men and women of goodwill and extraordinary administrative skills and knowledge, individuals who share in his vision of leadership and who are there to promote the public good. Our state is like a barren desert, stripped of its nutrients by nature's elements, and one has to literally start all over again. This period of reconstruction and realigning of our priorities is so crucial because the right seeds need to be sowed and nurtured for maximum efficiency or productivity. In my humble estimation, this is going to take time and great sacrifices have to be made. So he must quickly get to work, define his agenda, and not allow himself to be sucked into the often divisive partisan politics of revenge and compensations. He might have come by way of Abga, but he is now the people's leader, and this is separate and apart because the expectations are high. The Araba was well fought for, and our people are longing for through leadership. Every seed he sows now will invariably determine how he is perceived for the next 4 years, and if hope for our future is ever worth believing in. Certain factors continue to elude our people and leaders for generations, or should I say that they have been in morbid denial. We are what we are today simply because of the seeds that we sowed in the past. And judging from prevailing conditions, who will deny that the wrong seeds have been long sowed? If we must anticipate or rather envision a better future here and now, we must sow the right seeds, because it's only a deranged human that will sow grasses and expect corn and rice at harvest time. As painful as the truth is, we must acknowledge that we have been our worst enemies for decades. Year after year, we hear pronouncements from our governments about the millions and billions of budgetary funds, and yet when we look around, everything still stays the same, and we continue to see a society in retrograde. Simply put, things just do not add up. So much is missing, and it's that which is missing that is at the core of our hardship and pain. Our people need great help, urgent help to stand up and take pride in life again. Restoring their human dignity is a task worthy of any sacrifices. A working system that guarantees a degree of true happiness and enduring hope is their solemn right. From the cost of living to the general physical health, the Rochas administration should quickly assume these responsibilities, for they are within their job description and purview. Questions as to how life for our people can be greatly improved should be at the forefront of our new government agenda. At this point, their problems are so humongous and deserve every resources to be invested. From subsidized housing in Lagos and Abuja to the mortality rate in the state, these problems need to be urgently addressed. I honestly believe that our Imo State government has a responsibility to protect and assist any of our citizens, irrespective of their current place of residence anywhere in the world. Infant mortality has peaked, and so also is the general mortality across the state. Life is a great gift from God and must be ever treasured. And so must our government acknowledge and live by this principle. Time to face up to the realities is now. There are causative elements within our control and staring us in the face. The number of individual hospitals and clinics in our nation, as well as in our state, is so ridiculous. It's dangerous that attempting to monitor them effectively will be an overwhelming task. As a result, no one can conclusively determine the quality of services and the level of knowledge of the medical doctors, coupled with unsanitary environments that our healthcare is traditionally delivered, all combined to produce the kind of epidemic we are currently experiencing today. So many of our people have continued to die from preventable diseases. Simply because one has attained a degree in medicine does not automatically ensure efficient or sufficient knowledge on the field. The need to limit and impose strict standards of operation is urgent. Medical care is not car parts business. The need to make money should not be permitted to outstrip caution. If there's any one field that deserves government constant watch, it is the medical field. Just as these doctors are rushing in to pick up knives and start cutting our people, our state government should rush in to take away these knives from them. Many of these doctors are engaging in services beyond their scope of knowledge and specialization. These knives are simply murder tools in their hands, and some thorough certification and disqualification method ought to be put in place. Every year, even years of expertise do not eliminate the undoing of negligence or carelessness of doctors. The use and abuse of alcohol by some doctors are well known and demand close scrutiny, as well as the conditions of equipment used in these hospitals. Complications from surgery and infections have become so common and are taking lives. And to make matters worse, the kind of drugs sold today in our chemists, imported or manufactured by local industries, have been grossly compromised in terms of potency, that it would be a serious crime to dispense such drugs in any nation where law and order are strictly enforced. Many of these drugs have led to sudden deaths and irreversible deformities. The peddling of pharmaceutical drugs on our streets, our highways, and every corner is nothing but a direct source of poison to our people. Many of these drugs are fake and concocted in environments only the good God can see. I know we all have to earn a living and survive. But earning a living by fraud and mass deception is illegal and immoral. There should not be any reason drugs in our chemists are graded by price. All drugs should at least achieve their maximum purpose or be entirely removed from the counters or shelves, as we choose to call them. The sensitive nature of this area of business should be such that no government should leave room for errors. Slowly phasing out these chemists and assisting their owners to choose other means of livelihood is essential. Just as many of these substandard hospitals and medical facilities ought to be phased out. Any state government can invoke its right to protect its citizens and crack down on these menace. Creating a regulatory board to oversee public health care and set general standards is essential. A good reporting system that ensures every death is thoroughly reviewed. No one should be buried without proper autopsy to determine cause of death. It is this level of accountability that will drastically reduce our mortality rate. Government must show a keen interest in the health of our people and eliminate the human factors that negate proper care. Death has become so rampant in our villages and towns that our people have become so desensitized. There must be an answer, a way to curb this epidemic, and I urge this present administration to make health and public safety its most urgent priorities and trajectories to uplifting our people. Having said all this, let us not forget the fact that longevity is a lifelong initiative. It should begin at birth or conception and continues into adulthood. Prenatal care should be mandated for every pregnant woman, while every adult should be encouraged to seek regular checkups. Our environment holds many health hazards, and only our ignorance conceals the truth that we have a lot of work to do to exploit the extent of these hazards and dislodge the culprits. Early detection and prevention are pivotal in prolonging life. All these efforts should be at the expense of our state government. I sincerely believe we can afford to provide our people quality health care and at the same time provide other essential services if we can sufficiently check abuse of public funds. For decades, we have hesitated to seek international contractors to build all kinds of infrastructures for us. A huge percentage of our national and state budgets have been supposedly directed toward procuring foreign expatriates. This is an obvious evidence or acknowledgement that we are not everything and do not know everything. And we are not alone in this frame of mind. Even advanced Western nations will stop at nothing to secure the best minds the world can offer, to join in their pursuit of excellence in service delivery. There are Nigerians, Indians, and other nationals today who are highly placed and paid to stay in these Western nations because of their skills. Quite often, we have foreign agencies sweeping through the globe in search of highly skilled nurses and other professionals, sometimes to the detriment of the nations, as such exercise is a brain drain. If these Western nations can expend their energy and resources to attract foreign talents, siblings, I see no reason we should hesitate to recruit foreign doctors and other health experts to come and assist us to save the lives of our people. After all, they manufacture the medical equipment and over 90% of the pharmaceutical drugs we utilize in Nigeria. They even manufacture the same drugs we adulterate without guilt or shame and go around unpunished. Our actions are criminal in nature and sinful before God. It is so unfortunate how we do not hesitate to have blood on our hands, all for the sake of money. It is fraudulent to offer a second person something worthless and taking their money. Second, fake drugs endanger lives by giving people false hope that eventually give way for death. You are not better than the armed robber who walks into a house and kills the occupant. Your hands are essentially filthy with blood. My people, life is not cheap. We must do all we can within our human power to preserve it. Every citizen of Imo State should be part of a wellness program that is geared towards determining the overall health, addressing their nutritional needs, and offering them the kind of health education that is essential to a better quality of life. Imo State can afford real mobile clinics that offer the basic treatments and tests on a daily basis. A lot of time, so many of us are unable to realize the symptoms of many diseases until it's too late to save their lives. We can afford well-equipped hospitals with both foreign and local doctors working in partnership. Most of us do not have to run out of the country to receive meaningful treatments. If we can sincerely wage war against corruption and waste, our health goals are within reality. Our new state government should take the lead and demonstrate it is a true government of the people for the people. It's about time that we end our inglorious attitude to governance, because it has a direct and unabashed threat to our existence. Our disingenuity as leaders has been quite obvious. The choice we make from here on is in our mutual interest. We will either survive or perish together as a people. After all is said and done, there are no guaranteed safety nets, and we are all exposed to the same dangers that we indirectly or directly create. When one embezzles money earmarked to maintain the roads and suddenly loses a loved one as a result of bad roads, he or she is culpable, just as in other areas of our lives. The hands of retributive justice is always at work. The choice is ours. Thank you, and may God bless you.